Psychopharmacology. Goal: identify common nerve cells and basic neurotransmitters associated with psychotropic medications. Americans. We tend to think to like the quick fix. And if you go to your doctor, you want a cure. Most MDs have one tool. They know medicine. 65-year-old is on about 6 prescription, 45 4, 45 3. So it's less than 4 but greater than 3. And then 18 to 25-year-old is on 1 prescription. How nerve cells work. 100B. That make up the brain, spinal cord, peripheral nervous system. Chemicals are synthesized in the neuron, then released to the desired areas. Mechanisms exist to deactivate or remove the chemical from its desired site, like medication assist treatment. So you've got the cell here, the structure of your typical neuron, nucleus, dendrites, cell body, the sleeve here, the Schwann cells, node of Ranvier, and axon terminus. Neurotransmitter process. Key neurotransmitters: serotonin, more active CNS focus inhibitor of activity and behavior, mood regulation, control of eating, pain regulation, sleep, and arousal. Dopamine, both excitatory and inhibitory effects. Control the brain's reward system and pleasure centers. Epinephrine, fight, flight, or freeze response, and norepinephrine, wakefulness and alertness, are primary roles. How cocaine messes with neurotransmission. There is no room for normal transmission, so the natural processes change. Dopamine can be forever altered. Think of the receptors as golf tees. It needs something sitting on top. Best case is neurotransmitters. So this is an image of that. So you have the transferrin neuron, dopamine receptor transporter blocked by the cocaine here, the dopamine, and it's just current dopamine. So the receiving neuron is getting the intense effect of the dopamine through the dopamine receptors of the cocaine, if that makes any sense. Drug administration. Your covers 10, there are 12. External route, enter the body by the gastrointestinal tract, so oral, sublingual, tongue, rectal forms, intravenous, eye. Slowest method, most absorption is 5 to 30 minutes after effect, but effect lasts 6 to 8 hours. Parental injections. Direct, not subject to gastric juices, delays caused by stomach emptying process or mixing with other foods. Subcutaneous methods. This allows for slow administration. IM injections, intramuscular. Directly administered into the muscle, resulting in direct blood contact, slower process. And then there's IV injections, which is intravenously, and it's directed right into the brain. It's in the brain within 15 minutes, and this is irreversible. Others, we have transdermal, like a nicotine patch. Drinking enters the stomach, eating as food, pill form, tincture, inhaling through a mouth. processes after administration: absorption, distribution, metabolism, excretion, known as parakinetic process. Typical classifications of psychotropic meds: antidepressants, which has 3 generations, anti-anxiety, 2 generations, antipsychotic, mood stabilizers, and stimulants. There are go-tos for doctors, but the list changes frequently, so no need to memorize this. So this says, know your drug classifications. How drugs are classified in the U.S. I'm not going to read all this. I'm just going to leave this up as a reference point.